If you want to think about when NCQA got started, it was when everybody was kind of behind the idea of health maintenance organizations. And health maintenance organizations had the advantage that you could hold them accountable for quality and costs and patient experience. But people were worried because this was a revolutionary way of paying for care. So in the prior system and what we still have today, you have fee-for-service where you make more money the more you do and the more complicated things you do, not the better the outcomes that you produce. And so HMOs were an attempt to kind of really kind of steer the system in the right direction through a payment system. But everybody understands that if you get paid per member per month, one way to make money, the really easy way to make money, is to not give people what they need, so to hold back needed care. And so if you don't have quality measures to balance that, then people were very worried. Now, you could still say that, you know, that was assuming that fee-for-service was the perfect system, but it was what people were used to. So the idea that we were going to pay people to be more efficient, they were going to make more money if they were more efficient, brought its own set of worries, and that's what caused the whole idea of that accountability for quality. But actually, you need it no matter what the payment system is.
You need quality no matter,
exactly,
and quality measures
exactly.
and improvement.
And now I think, you know, there was a large backlash to HMOs, and employers then went self-insured, and you know, we're now in a phase where we have very high deductibles for employers, where people actually think twice before they go to the doctor. And so I think we're in a point when the cost situation is really overshadowing quality and really making it hard for people to deliver high quality health care.
And that obviously that's a concern for us, but it should be a concern for everyone.
It should be a concern for every American. It should be a challenge for policymakers, right? Because we want to get the biggest bang for the buck, the most health for the healthcare dollar. For patients, patients want to get what they need to be healthy, right? For people that are working in the delivery system, doctors, nurses, all the people that work in the delivery system, they went to school and all the years of training to try to make people better off because of what they do. And if people can't even get to them because they have to go past a big deductible.
I'm not going to the doctor because I'll have to pay the full bill,
exactly,
and I can't pay $5,000.
Exactly, exactly. And there are some crazy deductibles out there. And if you're a low-income person, even a small, you know, even a $2,000 deductible can be a real barrier to seeking care.
Don't those sort of plans then just become catastrophe insurance in some ways?
Catastrophic insurance, yes.
Yeah.
I mean, if you make it high enough, that's a catastrophic coverage. And that means you're not covered for
you're
the
not
care.
Insured,
that's,
right?
And actually, it's the primary care, if you don't design it right, that gets compromised. And that's really some of the most effective care we have.
And for prevention and catching things early, that sort of thing. So I guess when we talk about this, and there is a lot of talk about cost these days, and you've seen it change several times over your period of work, is it particularly frustrating that the foundation changes? Like, you're trying to affect change up here, and every 4 or 5 years, the foundation changes where we're going. And right now, we don't know for sure where we're going.
Yeah.
But does it make that all the much harder to get quality to move up on the priority list?
I think that healthcare is incredibly complicated, right? I mean, the business of healthcare is very complicated, the delivery of healthcare. But there are so many other factors that play into it and so on. I actually find it interesting and challenging to kind of, it's kind of when you take on a complex problem, what I've learned is there is no simple solution, and you've just got to keep working it and paying attention to the feedback that you're getting, watching out for unintended consequences, which are a big deal. So yes, I get frustrated at times because there's the silver bullet of the day, the fad that's going to save us all. And we've been there, and it's kind of, it never works because there is no silver bullet. There's no simple solution to this complicated situation that we have in healthcare. It's also, even if you sat there and tried with the smartest people in healthcare to figure it all out, it would work. It might work for a while, but it never, there's just, it's like an organism, a highly complex organism. It's like taking a simple-minded approach to human health. If I just give this one treatment, then the person will be healthy, and it's never that simple.
Public funding for healthcare, there is a lot of talk about sending the money in block grants to states. What challenges does that create, and what problems does it solve, if it does solve some problems?
Well, it creates a lot of challenges in terms of equity. I mean, what does it mean to be an American? To be an American shouldn't mean that I'm going to be worse off because I live in West Virginia than if I live in Massachusetts. I mean, there is a foundational aspect of being an American, and I think we haven't gone to the point where people are ready to let go of that. Flexibility also brings a lot of complexity, and so if everybody's doing their own thing, I think it becomes much harder to understand what's working, where are things going south in a big way. So trying to have some common metrics. I mean, this is what we're all about, right? You can't have accountability if you have situations that you can't look at the outcomes of. And that's what we do. We provide the information that says this is working better than that, and so forth.
So if it does go to states, it would be helpful if they all found sort of a common central measurement and language.
That's not going to happen. That is not going to happen. No, it will not. I mean, in every other way, states do things differently, and why would it be different in this? Let me just say, I believe every American should have health care.
What is, and I know this as a communicator for NCQA, it's a challenge to get people to put quality on their priority list when they're searching and comparing care. Why do you think that is? Why is quality not more important to them? They go, it seems
I think this is a really complicated question. Yeah. So if you're a payer and you're worried about money, it's a lot easier to assume that quality is happening, right? Than it is to say, how much quality is happening? What am I buying here? That's really the important thing. What am I buying? Because you can spend the money easily and get really poor results, or you can get good results. That's the point. And better care is not necessarily cheaper care. And I think this is one of the big disconnects in the public understanding, that you can spend a boatload of money and get really horrible results. And in fact, the more disorganized the system is, the more the chaos is driving the costs up. So the understanding that if you really organize care well, if you coordinate it, if you're not duplicating everything or doing things that don't fit together for this patient, you're actually giving better quality and getting to better costs. That's a very hard message for people to understand. Now, why isn't quality more important is your question. There's another aspect of this, and that's if you're a patient. And if you're a healthy patient, you're not so worried about it, right? Because you're doing okay, and maybe your doctor tells you have high blood pressure, and maybe you'll understand how important it is to control that. But if you have cancer, you are riveted on, am I going to live or die, and what's my quality of life going to be? And there is a desire to believe that I have the best doctor. We've done a lot of focus groups with patients that are seriously sick, and this is a highly predictable and reliable outcome of being very sick, is that I want to believe I'm going to the best place and the best doctors. And we don't want to interfere with that, but we want to make sure that people can put their faith, it's kind of trust but verify.
Right, because often the very best doctor is a word of mouth doctor.
Exactly.
Correct?
Exactly.
And so you can get a recommendation, yeah, this guy's the best guy, but then you find out he's terribly busy, he or she can't see you,
right.
They're always late for appointments, and they're so busy they may not really be on top of your case. So that word of mouth. So I always look for you, and it's sort of selfish in this case, for some direction into how we reach those people that quality is as important as cost.
I think
and
it's through
convenience.
stories. I think, looking at data on how is this plan doing with diabetes, it's kind of dry. People look at it and they say, why should that matter? Well, if you think about it, if your diabetes isn't managed right, you could go blind. You could have your legs amputated. You could go into kidney failure and be on dialysis for the rest of your life. These are real things that happen, and they happen less when proper treatment is followed, and that's what we're measuring. So we have cut, I've seen articles from the Centers for Disease Control on how diabetes complications are down by about half. And I don't think people connect the dots that that's about accountability for quality. That quality matters. It really matters. It matters to you. It matters to your cousin that has diabetes. It matters to your aunt that has cancer. It's real people's lives that are at stake. It's a matter of life and death, and it's a matter of the quality of the life.